in ASCENT-03, there were 6 treatment-related deaths, all related to infection. 5 were in the setting of neutropenia in patients at risk.
Now, what about safety signals? I mean, when we make treatment decisions in the clinic, we spend much of our time talking about anticipated toxicities and whether or not prophylactic treatments need to be given for various toxicities. How would you compare the 2 ADC molecules in this case in terms of expected toxicities and co-medications that might be routinely recommended?
It's a very important point. So what we saw between both studies was that there were fewer grade 3 or higher events in TB02 with Dato DXd compared to SG in ASCENT-03. Okay. So there were about 33% of treatment-related AEs that were grade 3 or higher with Dato DXd versus, I believe it was 66% of treatment-emergent adverse events that were grade 3 or higher with SG.
I assume much of that was probably hematologic in the case of
Correct.
SG. Is that
yes.
right?
Yeah. So neutropenia, diarrhea, those were the main side effects with SG. And with Dato DXd, there were 60% of patients who experienced oral mucositis or stomatitis, and 8% who had grade 3 events. 47% experienced ocular surface toxicity, also 7% grade 3 or higher events. But what was interesting, so most of the grade 2 or higher adverse events had resolved to grade 1 or baseline by the time of the data cutoff. Okay. And there were relatively few dose interruptions or dose reductions required because of those adverse events. Okay. And few ILD events, and importantly in TB02 there were no treatment-related deaths. In ASCENT-03 there was a higher rate of serious treatment-related AEs. Importantly, with both ADCs, the rate of discontinuation of the ADC due to toxicity was 4% for SG and for Dato DXd in each study. But with in ASCENT-03, there were 6 treatment-related deaths, all related to infection. 5 were in the setting of neutropenia in patients at risk who had not received prior primary prophylaxis with growth factor support. As you know, the FDA label was updated recently, and it is very important to use primary prophylaxis with growth factor support in patients, at least in those who are at increased risk of febrile neutropenia. So growth factor support is one of those pre-medications or concomitant medications that we need to think about with SG. With Dato DXd, because of the ocular surface toxicity and mucositis, eye drops, artificial tears, and a steroid-containing mouthwash are recommended as prophylaxis at least 4 times per day. Okay. And we do need to be very mindful always of ILD monitoring also on Dato DXd, but again, there were few events on this study.
And the eye drops are not steroid containing; they're just moisturizing.
Yes, exactly. Yes,
like saline-based
yes.
eye drops. Okay, good. And the oral Decadron mouth rinse, is that effective in this case with Dato DXd?
So it's a very good question, and we don't have data on that yet from this study, but it will be very important to look at the prophylaxis, adherence to the prophylaxis, and also I think the PRO component, the patient-reported outcomes, right, and differences if there may be in quality of life and certain measures that may capture some of these side effects that are experienced with the ADCs versus standard chemotherapy.